Carrie, the nurse with Home Instead Senior Care. Today I'm going to show you how to assist a client with a bed bath. So maybe they had a stroke, maybe they're not feeling well, or maybe they're in hospice and they're just bedbound, they cannot get up. So a traditional shower and a sponge bath like in the bathroom, that's not going to work. So we're going to go ahead and do it in bed. So a few good things to have in place, I will tell you, but first I would like to introduce our star, Susie. She's going to be our patient today. So Susie, how are you feeling?
I'm feeling okay.
Good. Did you sleep well?
Not really.
Not really. What's going on? Are you in pain or just can't sleep?
I just can't sleep.
Can't sleep, okay. Well, we'll get you washed up and smelling really nice and put some warm lotion on you and you'll feel really good. And I'll rub your back and maybe you'll sleep better.
Okay.
Take a little snooze if you didn't sleep well. That's okay.
Okay.
All right?
Yeah.
Okay. So I have, this is a bath blanket, so we could use, if you don't have like a large, some of like the oversized towels work nice, but this is an actual bath blanket, an extra quilt. I went ahead and put this in the dryer for 10 minutes first to make sure it was warm, and I had Susie check it before I put it on her that it was comfortable for her. The other things you want to have underneath the client for bathing is some type of absorbent pad called the Chucks. There are the throwaway kind that are either blue or green like this. In a lot of homes, you will see the kind that can be washed. So you want to make sure that you have the cotton side towards your skin and the water absorbent side away from their skin, because we want they're laying on their back and bottom so much, their skin is going to be possibly impaired. So we want to keep that as healthy as possible. And if you think about when you have a massage, you only expose one body part at a time so you can stay warm and don't feel so vulnerable. That's what you want to do with a bed bath. And we want to promote as much independence as possible. So if you're able to participate, we want to go that route as well. So, Susie, do you want to check the temperature in this water and tell me if it's okay? Is it too hot? Okay, we'll go make it a little cooler. How's that?
Better, much better.
Okay, good. Excellent. So I have a basin of water. There are several ways, correct ways to use a washcloth. Some of you have maybe been trained with the mitt, which is basically outdated now. That's not recommended anymore. So you can either do the traditional washcloth like this, or you can fold it into a triangle. So you have 5 clean surfaces. You have a clean surface here, fold it, another clean, fold, and so forth. So then you're always getting a clean surface, especially when you're washing towards the bottom. You want to make sure you're not contaminating anywhere and putting them at risk of getting a urinary tract or bladder infection. So, can you wash your face?
Mm-hmm.
Okay, excellent. Would you like to dry your face?
Thank you.
You're welcome. So I only use water for the face because the water is very delicate. I never use soap for the face. That's not recommended. Unless you're really greasy or oily, then you could use a real mild soap. But typically do not use soap on the face. How do your ears? Did you get your ears pretty well too, or you feel kind of grungy behind your ears?
I didn't do my ears.
Okay, then I will help you with that. So I just squeeze some, so I do have some soap for back behind the ear because that gets kind of oily. So all right. So I'm going to go down. One more time. So we're going to rinse. So I just have rinse water here. There we go. Let's dry your ear for you too here. You don't want to get that, have any other problems there. There, how's that?
That feels good.
Okay, excellent. So let's start with your arm first. So I'm gonna put this towel underneath your arm in case I drip some, because I know these are your favorite sheets and we don't want to get them dirtier any sooner than possible. So you can just relax. So I have some soap on the washcloth. And what we're gonna do, we're going to start from the outside of the shoulder, work down for one washcloth. Have a second washcloth for the hand. And have a third washcloth to work up and into the armpit. So that's the plan. Alrighty. So we're gonna go ahead and get your arm here, Susie. And we're gonna do your hand. If there's a shortage of washcloths in their home, you can modify this as long as they don't have any infectious disease. So if they would have, have active diarrhea, maybe have C. diff going on or something like that, you want to be really diligent of always changing your washcloths so you're not potentially contaminating them more or contaminating yourself. But Susie is overall very healthy and doesn't have any kind of infectious disease. So we don't have to be super strict on the washcloths for her. All right, let's go ahead and wash your hand. Oh, your hands are so cold.
They're always cold.
Oh.
So are my feet always cold.
So that must be you have a warm heart then, huh?
That's what they say.
So how is your knitting going?
It's going good. I'm making an Afghan for my grandson.
Oh, very nice.
Mm-hmm. He likes purple.
Purple. Ooh, that's a pretty color.
Mm-hmm.
And now I just have rinse water because we did the soap, so now we have to rinse. We'll finish the rinsing. Very nice. Let's get those fingernails a little bit better. Ooh, somebody polished your nails. Who did that?
I did it.
You did it.
Mm-hmm.
Ooh, that's pretty.
Thank you.
You're welcome. And then let's go ahead and dry your arm. I don't want you to get cold. And now we're gonna go up and we're gonna get your armpit, get that all clean. Let's do one more. Okay, and now we're just rinsing. And let's do one more rinse. There you go. Oh, is the towel feeling it's still pretty warm?
It's good.
Good, good. And I also had her container of lotion in a different basin, a separate one from this. So if you put some like lukewarm water and put the lotion in there, it's not so cold, which is really nice. And you can, once for lotion and stuff, you really should have gloves on in case there's any open sores. I know Susie does not have any, so that's why I'm not wearing gloves for this part of the bath. But anytime you're working anywhere at the bottom or any feet that have toenail fungus, you definitely want to wear gloves to protect yourself. So, excellent. Okay, we're done with your arm. So let's go ahead and work on your leg. How you doing?
Good.
Good. I'm gonna help you lift your leg up. Ooh, you're so cold. We'll cover you up for a minute and get warmed up. And the rub on the inside, on the outside, and let's go underneath. Okay. Now we're doing a rinse. How you doing, Susie?
I'm doing good.
Okay, so we're gonna rinse.
The water's starting to get a little cold, so
I will switch that then. How does that sound?
that's good.
Okay, and we'll go ahead and lift your leg. Put that warm towel on her and let you dry some while I go ahead and change the water, okay?
Okay.
Okay, so everything's nice and dry. Good. And I had your lotion. Your lotion is nice and warm. How does that feel?
Good.
Oh, good. So go ahead and put some lotion on. So I'm going to work down, underneath.
Can you do my feet too?
Yep, I will do your feet as well. So can you help me bend your knee? We're going to bend your knee, okay, Susie?
Okay.
And go ahead and put your foot in there. How does that feel?
That's,
Are you comfy?
it's rubbing on my leg.
Yeah, let me grab a washcloth.
Oh, that's
Is that better?
Much better.
Okay,
Thank you.
you're welcome. So her toes are clean, there's no nail fungus, so I do not need to wear gloves for her feet. But typically nail fungus, the nails will look cloudy. They may look very, very thick. They may look kind of yellowish, golden tinged. You'll definitely notice that something is not right. Now we do partner with Happy Feet, Fox Valley Foot Nurse Association. So there are nurses that come into the home and can provide them with foot care at a pretty reasonable cost and none of the stress. I know we had a client that when she went to the podiatrist, she screamed the whole time. She had dementia, she was so scared. So we could have a nurse come to the home, their private home, work with them, have like a salon day, and it's a lot more peaceful and good quality of life. So there are a lot of options, so keep that in mind when you're working with your clients. Okay, we had your foot soaking for a while, so I have some soapy water here. I want to get between the toes. All right. And let's rinse a little better. Okay, let's go ahead and lift your foot out. And we'll get that dried. I want to dry between the toes as well because yeast could grow in there or fungus. And let's get some of that warm lotion. Now when I'm lotioning her feet, I am not putting lotion between the toes. Never put lotion between the toes because you're just asking for yeast to grow there. Okay, go ahead and lift your leg up. And this is not a hospital bed, or I would have lifted this up to proper working height to support my back. So when I'm bending over, I'm making sure to try to use as best a body ergonomics as possible, because you know this could take up to a half hour to complete a full of the bed bath. So make sure you're taking care of yourself as well, because your client is depending on you. They need you their day, you know, each day or 3 times a week that you're coming. So it's very important to take care of your own health as well. Well, Susie, now it's time to wash your bottom. Okay?
Okay.
So I'm putting up the guardrail here. So there's a guardrail on this side, and you're going to turn towards me. So the best way to get your client to start turning is to slightly bend their leg, put it over the other leg. Can you hold on to the grab bar over here and help turn?
Mm-hmm.
And then we're going to turn her as a unit. There we go.
Is that good?
That is good. So let me cover you up so you don't feel quite so cold, okay? Put this on your back for right now. So now I'm putting my gloves on, because anytime you're working in the front or back bottom area, you need to have gloves. I will show you a better display of washing the front of a female on a mannequin, but right now we're just going to work on the bum or the back area. So if your client has been sitting maybe in a wet Depends or a soiled Depends for a period of time before you arrived, there may be some dried on, stuck on bowel movement at their backside. So the easiest way to get that off is to have a warm soapy washcloth and put it onto the skin and just hold. Because you want to release that. You don't want to be scrubbing because their skin is already irritated from the acid from the urine and the bowel movement. So just apply pressure, gentle pressure, to try and get that to release. And it may take maybe 2-3 minutes. It might take 3 or 4 washcloths, but it looks like we did it well on the first try. Okay. So on the back side, the dirtiest part is near the middle part, like by the buttocks, like the crack area or by the anus area. So we want to do that last. We want to go from clean to dirty. And we want to go from down upwards. So we're going to start on one side, the other side, and then here's where we go the dirtiest part. So we want to go down the midline by the crack area and work up. How are you doing?
I'm doing fine, thank you.
Okay, now we're going to rinse. So cleaner, cleaner, and dirty. And then we're just going to pat dry because again her skin is impaired or potentially impaired from the acid. And then we have, sometimes they'll have a little, maybe a barrier cream, something they put on as a protectant on their bottom so that it doesn't open up or get sore. Well then that would be a perfect time to go ahead and apply that, and we're going from down upwards again on that area. And then help her with her Depends or her panties or whatever else she needs on. That part is done. Okay, Susie, I'll go ahead and help you. Roll backwards, okay? There you go. Are you comfy? I think we need to adjust Susie some. So Susie, can you give yourself a hug?
Like this?
Yep, just like that. And the count of 3, I have my power stance. Remember, up a building, you want a good sturdy base. You don't want a little base where you're just going to tip over. You want your legs shoulder width apart, a good stance, and you want to stick your butt out so you have your good body dynamics. I'm going to pull you towards me on the count of 3. And I'm going to use this pad right underneath you, okay? So on the count of 3, we're going to move, all right?
Okay.
1, 2, 3. There, so that she's adjusted better in bed. I just realized I forgot to do her back, but that would have been done before the buttocks. So, Susie, how's everything going?
Good. Are we done now?
I think we're done now.
Okay.
You want to maybe get some breakfast or brush your teeth?
I'm hungry.
You're hungry. Okay, we'll go ahead. I'll get you some
What's
breakfast.
for breakfast?
What would you like?
Fruit.
Fruit. How about fruit and maybe some yogurt?
What kind of yogurt?
Whatever kind. You have peach, strawberry?
Strawberry.
Strawberry. Okay, I'll go get you some yogurt and some fruit.
Thank you.
You're welcome. And today I'm going to show you the proper way to wash a female's client's bottom if she's bedbound and cannot get to like the toilet or into the shower. So this would be considering sponge bathing for the bottom or the peri area. So we always want to keep our resident or client covered as much as possible so they're warm and they don't feel exposed or vulnerable. So for this skill, I have a mannequin that I will be showing you this on. So even though it's a mannequin, I still want to keep them as warm as possible. So I'm going to have them covered. And underneath you, you'll want a absorbent pad or like a Chucks and also a towel. And it doesn't hurt to have an extra towel available, excuse me. I already had, if I was working with a person, I would have them check the water to make sure it was not too warm or too cold. And this is appropriate temperature water. And this will require a minimum of 2 washcloths, possibly up to 5, depending on what you need. And I have a basin of warm water, and I have a pretend squeezy soap. Right here is my pretend soap. So right now I'm starting with 2 washcloths in the water. And you want to have 5 clean areas of your washcloth. So it's just a typical washcloth folded in quarters, and then I went ahead and folded into a triangle. So when I wipe, again, I will have all the areas. We want to go from front to back only, and we want to go from clean to dirty. So for a lady, the cleanest would be right down the center, except not the rectum or anus area, and then go to the sides. So I have a soapy water. So again, I'm going down the center, switching. I'm going to go to the one side of the labia, switching, the other side of the labia, switching, more of the thigh pelvic area, and also more of the thigh pelvic area. So that was my 5 clean surfaces of washcloth. Now I have my rinse water. So again, front to back down the middle, front to back by the labia, the other side, thigh bottom area, thigh bottom area, and that one's dirty. So I had the soap and the rinse, so now I'm going to pat dry. Again, gentle, different area, different area. Different area, and a different area, so that we're not putting them at risk for urinary tract infection. Now I showed you the bottom with Susie, but again, just as a refresher, when you're working from the rectum back, you make sure you don't start here. So you don't want to start too high. You want to start here and then work up. But again, you're going from clean to dirty, so you would start from the outside and work up. The outside, work up, and then the middle and work up. And then also with the drying, dry from the outside, so back to front, back to front, back to front. And then you would assist them with getting covered up, make sure they're completely dry, and that they have a clean Depends or liner or whatever they're using in their panties.